All right. So my name's Keliane, and I work with Concord Regional Visiting Nurse Association and was trained as a master trainer for A Matter of Balance in October of 2012. And I look forward, I'm a fan of A Matter of Balance and usually have a lot of enthusiasm, but I promise I'll stick to my timeline as well and my anecdotal stories. So what we know about falls, and this is certainly the group that knows a lot of this information, but it's really the basis of the program, A Matter of Balance as well. So up to 30% of community dwelling adults fall each year. 20% of falls cause physical injury. And we know that falls are a leading cause of injury and death for older adults. Half to 2/3 of these falls are occurring around the home, where we spend most of our time. A majority of falls occur during our routine activities. This is something we hear a lot about from, I think, people our therapists are seeing out in the home following a fall, but certainly as people share stories in the class, people are falling while they're talking on the telephone and going to answer the front door. They're distracted, they're in a rush. Falls are usually not caused by just one issue. It's a combination of things coming together. Much like I was sharing a story with a class actually and coworkers just a few weeks ago. I went up into my son's bedroom, he's 5 in the morning, and I chose to be lazy and not flick the light because that seemed too exhausting. So the shades were still down, and I stepped on a little plastic knight in shining armor with bare feet. Then I flung forward and kicked the castle and landed on all fours. So there are a few things I could have done to prevent that fall from happening. Could have turned on the light, I would have seen it. Could have moved the toys out of the main traffic area and could have prevented it. So it's typically scenarios like that where we find ourselves in a fall predicament. And as we age, it becomes harder to recover from falls like that. That's my recent fall story. So a large portion of falls are preventable. We also know that falls are common. They can often be predictable. It's important to message to older adults in our communities that falls are preventable. And one theme that we try to carry out into the community, certainly with this program and really beyond that, is that falls are not a natural part of aging. And that's a really strong theme to the A Matter of Balance program as well. So what do we know about the fear of falling? And Dr. Bartels really hit on a lot of this information this morning, which was great, almost like a plant for me as well. So it is reasonable to be concerned about falls. It can be a motivator for having safe behavior and making lifestyle changes. But we also know that the fear of falling can also be associated with a decreased satisfaction in our life. It can be associated with increased frailty, depression, and then decreased mobility and social activity. So the fear of falling really is a risk factor for falls. And as Dr. Bartels alluded to as well, it very much can become a self-fulfilling prophecy for many older, frail adults living out in our communities. So the A Matter of Balance program is based on research conducted by the Roybal Center for Enhancement of Late Life Function at Boston University. And it was designed to reduce the fear of falling and increase the activity levels of older adults who have concerns about falls. Who would benefit from A Matter of Balance? A lot of people would benefit from A Matter of Balance. So any older adult over the age of 60 who has concerns about falls. And that's an important word to think about as well. Often the people who come to the program, if we use the terminology, are you fearful of falling? No, not me, I'm careful. I'm concerned, but I'm not scared of falling. So there's different terms that people are comfortable with utilizing as well. Anybody who's sustained a fall in the past, someone who might have started to restrict activities because of their concerns about falling. These are people who are out in the community who are no longer comfortable doing their grocery shopping because of the crowds, or because they have to walk from the car into across the parking lot into the store. They don't like to go to the senior luncheon trip anymore. They start to pull back from a lot of things that are important to their quality of life as well. For any older adult who's interested in improving flexibility, balance, and strength, there's both education component to A Matter of Balance as well as an exercise component. And the program really targets age 60 and over, someone who's ambulatory and able to problem solve. So in the program, we have had people with earlier stages of dementia or memory impairment. They often come with a caregiver, which has sort of a dual benefit. So there's the socialization, and they can both participate in the exercise component, and the caregiver will often learn some different home safety modifications that can be made, which probably benefit both of them as well. The goals of A Matter of Balance. So with Concord Regional VNA, we implement the program once a week for 8 weeks, and it's a 2-hour class. And over that time frame, participants learn to view falls and the fear of falling as controllable. It also works on setting realistic goals for increasing activity. And so we joke a lot about it's not the New Year's resolution to go from 0 activity to doing it all the time. It's baby steps, which helps them make a lifestyle change, not just participate in a one-time only exercise program. It also works to change their environment to reduce fall risk factors. And we spend a lot of time repeating a lot of these messaging points that I'm talking about over the 8-week program as well. So they're not just hearing it one time. And it also is to promote exercise to increase strength and balance. So what happens during classes? Group discussion is a really important part of the A Matter of Balance program. So the class is a minimum of 8 participants and a maximum of 12, which is a really good number to have. It's important to have at least 8 because the group discussion is crucial. You have the older adults meeting other older adults who are sharing their concerns about falling. And better than that, they start to help each other problem solve for some of the barriers that they may have to physical activity or to continuing to socialize, or on some of the modifications that they have to make in their home environment as well. So that problem solving piece is not me as a health educator standing up in front of the group and teaching them about home safety, but it's utilizing tools that are really geared towards self-management in the participant workbook that help each participant individually look at, I love wearing my comfy slippers that don't have a secure backing and they're slippery. Can I change that behavior? I don't know, I love my slippers. They're really important to me. And we talk about all the barriers to making the change, and the group can brainstorm on opportunities to make that change happen, and we work on rating our confidence as well. How likely is it that I can change this behavior? And we do that throughout the program so that they're building a skill set in problem solving as well with regards to fall prevention. Assertiveness training. This is really important. Oftentimes, a lot of the older adults that we work with and come across don't always assert themselves and ask for help when it's needed. Certainly in New England as well. It's proud. And in our rural areas, people will often say, no, I'm all set, I don't need any help. And so they may be likely to stand on a chair and change their light bulb instead of asking their neighbor to do that for them. So we work on advocating for themselves. If they leave a physician's office and they got some new medications or they recommended something, we talk about being assertive so that if you don't understand what they're talking to you about, asking more questions is okay. And so we work on some role modeling in front of the group and with the group as well to talk through situations to help them improve their ability to assert themselves. Yep.
Differentiate between assertiveness in regards to asking for help and just plain stubbornness. I need to do this, that panicky thing.
Yeah.
Because I think asking your doctor is a different kind of assertiveness than, I don't ask. You know what I mean?
Yeah, and it goes through many different scenarios. And it depends, because for some as well, they don't want to ask their physician because their physician is, I guess for lack of a better term, godlike. So it depends on the spectrum for the age that we're talking to. So my younger seniors are like, of course I ask them. I don't care, I'm going to get what I want. And so it depends, and there are many different scenarios that we go through for it. We also talk about the difference between being assertive versus being aggressive, which is important for them to understand as well. And then there's exercise training. So there's about 30 minutes of exercises that take place that focus on strength, balance, endurance, flexibility, and coordination. And we start those exercises in week 3 of the program and go all the way through week 8. So we participate in the exercises at the start of each class as a full group, and then we work on encouraging them to do the exercises between the classes as well. And when people start to put that together and make changes to their behavior, we see great things happen for some of the participants. We had one participant earlier on in the program, it probably was in the end of 2012, Louise. She started the program and she would come in, it was in senior subsidized housing, so she would come with a walker from her apartment, which she had to come outside, and she had her cane hanging off of the walker at session 1. Very quiet, hardly knew she was there, but she would use the walker, then the cane and the table to get to her chair for the program. We started the exercises in week 3 and then did some problem solving for it. She started to do the exercises. So when we would report back in week 4 and week 5, how did the exercises go this week? She would share that she had been doing them. She felt good about herself. She started to share more in class, and she made this change from being someone who didn't talk a lot to really being a champion for the exercise component of the program. And so Louise continued to do the exercises faithfully 4 times a week in addition to the class. And we bumped into her because we do other clinics and wellness things in this location. And it was at least 6 months after the program. And she was only using her cane, no longer using the walker. And she was sharing that she was still doing the Matter of Balance exercise program on her own in her apartment. So there are stories like that where it does make dramatic differences when people are at that right point as well. And they continue to do the exercises on their own. And she is still doing her exercises because someone else bumped into her. She has the manual and still does them as well. The class also uses video. So there's 2 sessions where we have a video component as well that has older adults participating in the video, and those are really well received also for the messaging. So again, it's not about me, the facilitator, standing up and telling them about other older adults. It's a video where they're observing, and then we have discussion afterwards. And sharing practical solutions, which I alluded to a little bit before as well. So a Matter of Balance national outcomes is what I'm going to use to focus on. We also measure our outcomes at Concord Regional VNA. We do pre-tests, post-tests, and 6-month follow-ups. And we are falling in line with the national benchmark or exceeding it at this point in time 3 years later. And so I chose to just select the points that they went through when they researched the program in 2001. So 97% of participants were more comfortable talking about the fear of falling. 97% felt more comfortable with increasing their level of activity. 99% planned to continue exercising following the program. And 98% would recommend a Matter of Balance to other people. And this is what we're seeing for participants who are taking our programs as well. This is a map nationally, just to give you an idea of where the program A Matter of Balance is. And it really is very well distributed throughout the country. For those of us who are master trainers as well, there's monthly calls that we can get on and hear what's happening in other states. This is New Hampshire, as best I could get it into my PowerPoint slide. Donna did it better than I did for her map. But this gives you an idea of where A Matter of Balance is currently available. And at the end, I'll share a little bit and disseminate as well. There are opportunities to increase our capacity for A Matter of Balance in Nashua as well as Coos and Carroll counties, which is an exciting opportunity for the state as well.
What are your colors, Keliane?
So the different colors are related to the agency that facilitates the program in that part of the state. So there's ourselves, which is really the green and the rainbow part. Then there's CAP of Belknap and Merrimack County, Then up at Dartmouth and in the Lebanon area, there are trainers. And I think it's down in Salem as well, right? So, and growing. So Concord Regional VNA's experience. So again, we implemented the program as a part of our community benefit offerings in March of 2012. And so if you're considering looking at implementing the program and you're responsible for providing community benefit activities, it's a great match. We found it to be an extremely positive experience for the people living in our community. It's been an opportunity for us to collaborate with healthcare providers in our community as well. And it really helps us enhance our mission and what we're offering. And when you really look at the cost versus the benefit, it's a program that we're able to offer with a really minimal cost that has a big impact and has created a lot of visibility for our organization as well. So at this point in time, we have 3 master trainers on staff. So there's myself, and then we have 1 community health educator, and we have a community health worker. So we are master trainers, and we have done master trainings with coaches. So this is a volunteer lay leader program. So the evidence base shows that you can train coaches to lead the program and still have those positive outcomes. So our organization, being a nonprofit, also has a volunteer base that helps with our hospice program, flu programming, and many different things that we do in the community. So we recruited from within our existing volunteers and then branched out as well. The majority are coming from our existing coaches, our existing volunteers through our hospice program, and it adds really a great balance, for lack of a better word, for them as well, because it's a variety. And we've completed, at this point, over 35 classes and had really close to 400 participants that were completers. And a completer would be someone who's completed at least 5 out of the 8 sessions of each program. Where do we hold our classes? In lots of different places. So we provide senior health clinics, which provide foot care, which many home health agencies do throughout the state of New Hampshire. So that gave us a good foundation for having strong community partnerships. And so we got out and met with churches, town halls, libraries, senior housing, senior centers. We've worked with some of our physician practices and outpatient rehab so that we can offer the program in those spaces as well. And what's worked well is that we haven't had people come to us for the program. In home health, we're really about getting out into the community and where people live. And so we wanted to reduce as many barriers as we could. So by offering it as a community benefit program, we are not charging participants for participating in the program. And we try to reduce the barrier of transportation, which is a real challenge in most of New Hampshire as well. So we provide it out in all of the towns that lie within our service area as well. Program fidelity as a health educator, this is something I think is really important with evidence-based programs. So as we grow our volunteer lay leaders and have them coaching the program out in the community, I think it's really important that we have the right support and continuing education in place, which is recommended by the program as well when you become a master trainer. So we do biannual volunteer coach education, and we'll utilize our professional staff as well for some of that continuing education with that volunteer group. It's an opportunity to talk about what's going well in your class, what's not going well, and it could be, well, whenever I'm teaching this exercise, it seems like the group's never quite following along, and then we can help problem solve together for that as well. But we also incorporate volunteer supervision at least twice during our 8-week sessions. It's not a requirement, but that is something that we have implemented really as a way for us to support our volunteer lay leaders so that they're comfortable teaching with other volunteer lay leaders as well. And as we rolled out, so the whole first year that we implemented this program, it was taught only by staff. So it was myself and our community health educator that taught the first dozen of these programs so that we felt that we were well versed before we started to build the program for sustainability and grow it with our volunteers as well. And by doing the pre-test and the post-tests and the 6-month follow-ups, You can look at it by site and by facilitator. So this gives us the great ability to really look at ensuring that our coaches are getting the same outcomes that we were initially getting as professionals doing the program as well. And it's continued to maintain that to this point in time. Promoting the program is really important. Anyone who tries to do community health programming or wellness programming knows there are times where if you can get 8 people to a wellness program, it's a major success. So for a matter of balance, it's actually been more often than not, we've had waiting lists for programs and we've added classes. So I will say it's been very positively received within our service area that we've offered it. But there are a lot of things that we have put in place so that we're regularly promoting it to our media through our communications person. We'll send out regular press releases. But then we've really built a contact list with our local churches so that we're sending it out to their bulletins. We're sending out flyers to churches as well to post. We have a senior center contact list, our home care staff as well. So our home care staff, I work to regularly promote it with, and it's a question as they're discharging a patient, would you like more information about fall prevention programs in the community? And then we can follow up based on a report to that question and provide them with more information as well. And it's a great next step. If someone's been making gains with physical therapy in the home, this can be a great next step to keep them active and keep them moving and to socialize as well. Outpatient rehab staff. So we have a great relationship with Concord Hospital Outpatient Rehab, and they collaborate with us for session 7 in the program is facilitated by a healthcare professional. So we utilize physical therapists. It could be an EMT or an OT as well, but we've utilized Concord Hospital Outpatient Rehab as well as our own home care staff. Oops, I hit my hip too hard. In order to facilitate session 7, but also to help us promote the program. We promote it to EMS, physician practices through our liaison staff, emergency departments, community gathering places. So we've literally driven around and gathered a list of post offices that have bulletin boards and laundromats that post this kind of information. And that's where we find the most success, is the grassroots promotion of the program and word of mouth. And then past participants of other agency programs. It's important to keep track when you're registering your participants. How did you hear about the program? And that will really tell you where you can best promote other types of programming as well moving forward and keep track of their contact information. So what are the benefits? Increasing fall prevention awareness in the communities that we serve as an organization. The participants that are completing the program are experiencing a reduction in fear of falling, and they are increasing their levels of physical activity. Also, it helps us be recognized as a resource for older adults out in our communities who have concerns about falls. There are times where someone may need more than what a matter of balance can help us with. So there might be times where we're working with outpatient rehab or we're working with home care to help connect people to further resources as well. And it's really helped us build and foster our relationships with other older adult organizations out in the community. Where can you learn more? So I put my contact information here. If you're considering offering the program, or if you do and you want to talk about how to promote it or get more information, I'm happy to be a resource for you. But I also put Rebecca Skye's information up here as the project director for the grant as well that Donna mentioned. And I also will pass around a sheet. So if you're interested in learning more about how you could become a master trainer or a coach for the program, you can sign up on this sheet and Rebecca can reach out to you as well. Any questions for me? Yep.
Could you talk a little bit about, I think you talked about completers. What's your experience with kind of how many people don't complete, but more than that, do you have a sense of people who are having trouble needing transportation? So 2 questions. How many complete, and also then how many people kind of aren't accessing it because they can't get the transportation, even though you're coming right into their community?
So for the completers, we probably fall, and I have the information, I might be able to tell you exactly after in my purse, but we're probably around 84% for our participation in people completing at least 5 out of the 8 sessions. And I could share as well, the average age for our Matter of Balance participants has been 72 years of age as well. Harder to track the transportation barrier outside of hearing anecdotally and knowing through our needs assessment in the community that transportation is the #1 concern identified on our needs assessments. I think that because of that, we're not even getting the phone call to register for the program. Yep.
Tests that you perform, the pre, post, and the follow-up tests?
So the pre, post, and follow-up tests are self-filled evaluations. So they're not something where we're having them go through, like in Tai Chi. It's self-efficacy scale, so to speak, and they are developed by Maine Health. So we utilize that rating about their fear of falling. Is it having an impact on their participation in social activities and their confidence as well? Yep. Yep.
Do you have a sense of how many go on? It's just kind of like MCHES or something like that, fitness activities?
We haven't tracked how many go on, so that would be something interesting to add to it, but I can anecdotally share as well that it is common for people among the group to continue to get together and do the Matter of Balance exercises in an informal way once the program completes. And also during that last class, it's not required when you do the program, but what we've done is gathered information for other opportunities, because you tend to get people to a point where they're more physically active and their fear feels more controlled, and so it's a great opportunity to link people to the Tai Chi program or to other wellness and exercise programs that are happening out in the community. Thank you.